Okay, so the big thing you want to know is the structure of the sarcomere. So when you look at muscle, remember the cell is referred to as muscle fiber. So when you talk about a muscle fiber, you're actually talking about that cell, and they can be huge, up to about 4 millimeters or so, which is gigantic for a cell. The muscle fiber, skeleton, and we're going to basically just be talking about skeletal muscle in this sense with the sarcomere and all that. So skeletal muscle is kind of the general what you study for microscopic structure. So the muscle fiber, is packed with myofibrils, and what myofibrils are is long straw-like cylindrical, basically, organizations of two different types of myofilaments, actin and myosin. Again, you've got myofiber, which is the muscle cell, myofibril, which is the things that are packed full, that muscle fiber, and then the myofilaments, actin and myosin. Those are the actual fibers that make up the myofibrils. So the actin and myosin are the two that you want to know. Old terms for those are thick and thin filaments. But you'll see both for those, but no actin and myosin. Those are basically the proteins that make up the sarcomere. So the sarcomere is what causes the stripes, the striations, when you look at a skeletal muscle fiber under a microscope. The biggest thing you see are the myofibrils, which they've got labeled muscle fiber here. So if you could zoom in a little bit more and see kind of through that sarcolemma, which again, oh, you guys haven't had nervous yet. So, okay, so trends with muscle and nervous. If you remember the cell membrane, kind of an older term for that was a plasma membrane or a plasmalemma. So the plasmalemma is the membrane of a cell, the outer membrane of a cell. The sarcolemma is to the same thing, but on a muscle fiber. When you get to nerves, you have a neuralemma. Okay, so same type of thing. It's just the cell membrane around the plasma membrane around a cell. So sarc refers to flesh. So you'll see sarc a lot with muscle. Sarcomere, sarcolemma, sarcoplasmic reticulum. Instead of the endoplasmic reticulum, it's the sarcoplasmic reticulum. Again, a little specialized in the skeletal muscle. So again, the muscle fiber that you're seeing here, packed full of myofibrils, this little straw-like long cylindrical organizations of your myofilaments, your actin and myosin. So when you look at your myofilament kind of bands, the striations, the bands, you can call those isotropic or anisotropic, and that's where you get I and A. I always thought it helped me to actually know what isotropic and anisotropic meant. That way you can kind of remember. So remember, iso means one or single. So isotropic, if you look at the I band in isotropic, you only have one type of fiber in the I band, and that is your actin. Okay, in the area where you have the A band and isotropic, not one, not a single, you have the overlap of the actin and myosin. Okay, you also have the area in the middle of that, a subset of the A band called the H zone, where it is just myosin. That is basically the distance between the end of the two actin myofilaments from each other. And again, another thing to understand is when contraction occurs, the fibers themselves don't shrink or change shape or anything like that. It's the amount of overlap. So if you notice, they're kind of like fingers that overlap. What increases as a muscle contracts is the amount of overlap between the actin and myosin filaments. So the actin filaments start to work their way towards the M line, and the two areas that shrink are the H zone and the I band. Those both shrink during contraction. The A band, if you notice, is the area of overlap between actin and myosin, but it basically is equal to the length of the myosin filaments. So the A band goes from end to end, from the end of one myosin filament to the end of the other. Give me just 1 second here. I will be back in just one moment. sorry about that. Okay, so again, it's important to understand what those two areas mean. So basically, the sarcomere, again, by definition, is from Z disc to Z disc. So when you look at the I band, a sarcomere really includes half of one I band, the middle A band, and half of the adjoining I band. So it's just kind of something to keep in mind. What you'll see in like a microscope or something like that is just the different areas, the anisotropic versus isotropic versus anisotropic, the back and forth. That's what you see as the banding or striations. The M line in the middle holding the myosin filaments together, that basically centers and holds those together. And again, the Z disc named so because of the kind of Z-shaped structure and the filaments there. Something that you don't always see mentioned in textbooks is the spring-like filament you see there at the end of the myosin that connects the myosin to the Z disc. Yeah, Titan is what they refer to that. I wasn't sure if they'd actually had the name on there, but that is what gives kind of the elastic property to muscle. Muscle will stretch, and it kind of recoils to a degree back to its original. It's got some stretch there. It's also got contractile ability, of course, but it does have some elasticity to it as well. So again, just to help you kind of visualize more what you see there, underneath it, you have a cross-sectional view of what you're looking at. And again, the actin is blue, myosin is kind of red, where you've got the M line. That is just kind of a network, again, centering all those red things, the myosin fibers. And then you've got the area of overlap where basically for every red myosin filament, you have surrounding it 6 actin filaments. And again, each actin has got kind of like 3 myosins around it, but they're arranged in a kind of a hexagonal structure. And what that does is increases the amount of contact between, oh, we don't have that, do we? Okay, between the heads of the myofilaments, the myosin and actin. So let's actually look at, let's see, that's 11. Look at 12. Okay, yeah. Oh, no, sorry. This one here. This one here is what I'm look at. All right, so the PowerPoint that I put up there, again, it's kind of got a little bit different material. But if you take the myosin and break it down, each little myosin fiber is basically kind of interwoven handles of 2 golf clubs, essentially, and like heads of the golf clubs, where the head meets the tail, that area can kind of flex and rotate. So what actually occurs, you'll talk about this more in the physiology of it, but I want you to know that those myosin heads, those bind to actin. Okay, so when you have contraction and overlap, that is those little heads ratcheting and kind of moving themselves in one direction along that actin towards the Z disc. Again, I don't know how much of this, we used to do muscle in 2 weeks, but when you think about contractions, this is something I may ask as well. So isometric versus isotonic. Isometric, again, iso is the same, metric, think distance. So same distance, the muscle develops tension, but it doesn't shorten. Okay, think of when you try to lift something that is too heavy for you to actually lift. All right, you're tensioning that muscle, but that muscle is actually not moving because you're not lifting that object. This happens all the time when we, tense ourselves up, but we don't actually move the bone. So you have isometric contraction, and you've got 2 types of isotonic contraction against isotone. Think the tone, the contraction. So the contraction is the same. So you have an isotonic concentric contraction, which is what we usually think of as a contraction. The muscle contracts and the muscle shortens. You also have an isotonic eccentric contraction where there's tension in the muscle, but the muscle actually lengthens. And this is actually how, okay, so picture what the woman's doing there. She's setting down a weight. So if you set down something heavy, you don't just drop it with gravity, you contract the muscle in that arm and set it down. And in this way, a contracting muscle kind of acts as a brake in some ways. So if you watch people walk, and sometimes somebody will flop their foot when they walk, that's because a certain muscle in their leg is paralyzed or not working right. And it's typically a muscle that contracts and acts like a brake. So when we walk, we have muscles that are acting to both, shorten the distance between those two muscles, and they act as a brake when that muscle actually lengthens. So you saw this in the lab manual as well, but you'll see the same concept with nerves, and that is the connective tissue layers that surround them. Okay, so let's start down here at the bottom microscopically with the muscle fiber. Again, this is a single muscle cell. So again, the muscle fiber has its sarcolemma around it, the plasma membrane, that lipid bilayer cell membrane. Muscle fibers are grouped together in what's called a fascicle, and those fascicles are surrounded by perimysium. And the endomysium actually surrounds, you don't see it labeled there, you see endomysium labeled up here, like within a fascicle itself. So the muscle fiber is surrounded by endomysium. The fascicle is surrounded by perimysium, and the fascicles together, the muscle itself is surrounded by epimysium. So endo, peri, and epi as you go from microscopic, from smaller to larger. Okay, so remember endo, peri, and epi. Epi is more upon, like a much bigger type of thing. Somebody needs maybe that. Okay, there we go. Shape, just be aware of. I'm not really sure I would ask you shape, but honestly, a name of muscle sometimes tells you the shape of the muscle. Brachii, biceps brachii, tells you there's two heads, so there's going to be two of these actually. But the generic fusiform is what we typically think of as a muscle. Tendon on one end, kind of a wider, fatter belly in the middle, and a tendon on the other. Again, the tendon it connects muscle to bone, ligament connects bone to bone. So you see ligaments and joints, tendons between muscle and bone. The rectus means straight. So rectus abdominis is going to be like straight fibers, parallel fibers, often with little intertendinous junctions that kind of define the muscle bellies. Again, triangular. Now there's unipinnate and bipinnate and multipinnate. That is used differently in some older textbooks. I've seen some different uses for that. But if you think like a flag, okay, so unipinnate has got the fibers coming off of one side of a common tendon, bipinnate two sides of a common tendon, like your rectus femoris, the one of the bigger quadriceps muscles, and multipinnate where you've got like smaller groups of those. And oculi or orbicularis, or we have an orbicularis oculi and orbicularis oris. But oculi tells you where it's at. This one's around the eye. Orbicularis oris is around the mouth, but orbicularis tells you that is circular. So knowing something about the shape, I think, is good for these as well. Okay, so let's see. Let's go back to. Okay, this list here is on, before we start, is on Canvas. And I pared this down, and I know it may look daunting, but I think, I don't know, I may pare it down a little bit more after talking with Dr. McDaniel. So let's just kind of start with some of these, and we'll talk about these. So basically, we kind of I started at the head and trunk, and then worked my way down. So epicranius, we'll talk about, is on the head. Zygomaticus major is the one that pulls up the corners of the mouth and causes us to smile. Orbicularis oculi and oris, again around the eye and the mouth. Platysma is a very superficial one you may or may not see on some textbooks. Temporalis and masseter, those are both mandible elevators, so they chewing muscles, and the intercostals we will talk about more like next semester when we get into breathing, as well as the diaphragm. And let me actually just take this break just to double check. You guys are seeing a list of muscles to know, right? Like muscle names. Somebody give me a thumbs up in your little response box. Yep. Okay. Thank you very much, Emily Harris. Yes. All right. Good deal. Just wanted to double check. I did a whole recording a couple semesters ago, and I wasn't screen sharing what I thought I was. So, okay. So rectus abdominis, internal and external oblique, transversus. Those are the three layers of the abdomen. So we'll talk about those. The erector spinae group are a large back muscle group that has a lot of small subdivisions, but just know them as erector spinae. They keep your spine erect. All right. Pectoralis minor and major, those chest muscles. Serratus anterior acts on the scapula. That's the boxing muscle, that's well defined in boxers, where if you kind of look under their shoulder, they look like they have like fingers interdigitating. But again, it's serrated, so it's got the 8 little fingers that come off. Trapezius, rhomboids, large back muscles, latissimus, teres major, is again another back muscle. These guys work on the scapula or the humerus. Supraspinatus, infraspinatus, subscapularis, and teres minor. These are your rotator cuff muscles. Some books refer to them as the sits muscles for the acronym SITS, whatever. But if you, again, we talked about the bones. You know, these are named for those fossas within the scapula where they sit. Deltoid, that's where you probably have gotten your injection if you've got a vaccination lately, or it could be Hep B or whatever, right in the beefy part of the shoulder. Biceps brachii, corca brachialis, these are our upper arm muscles. Retinacula, I just want you to know kind of the concept of, and we'll take a look at those here when we get to it. Brachioradialis, again, telling you, from the brachium to the radius. Gluteus, medius minimus maximus, the TFL, tensor fascia lata, and the iliotibial band, those three kind of together. Well, gluteus maximus anyways, the TFL and the iliotibial band, those three are very important hip flexors and extensors. They kind of like lock your legs in, or your knee, but again, it'll make sense when we look at those. Piriformis, I debated leaving this one in here, but I think this one's important. You just at least recognize the name, because that is often involved in sciatic nerve issues. The sciatic nerve runs close to piriformis, and often a tight piriformis will cause sciatic nerve issues. Iliopsoas, a deep trunk muscle in the kind of lumbar region, pelvis, but it is a very important hip flexor. Getting into the thigh, we've got sartorius, rectus femoris, vastus lateralis, medialis, intermedius. Those are your quadriceps right there. The quadriceps muscle are those, the rectus and the 3 vastus. Pectineus, I'll probably actually cut off, but pectineus and the adductors, just kind of know those as the adductor group. You've got these large muscles on the medial part of the thigh that attach the femur to the pelvis, and again, do just what they say, they adduct. Gracilis is an adductor as well. It's a very long, skinny one. Then we get to the back of the leg. We have the biceps femoris, semitendinosus, semimembranosus. These three are your hamstrings. And then down in the thigh, the tibialis anterior, gastrocnemius, and soleus. I deleted a bunch that I had in the forearm. We're not going as far as the forearm. And like I said, don't let these worry you too much. We'll revisit these each week between now and then. But you should want to know these on a model or like a diagram. Let's see my screen share okay. Let's see if I can zoom that in a little bit. There we go. Yes. Okay. So let's go over a bunch of those muscles we just looked at. So the epicranius is one that I used to know as occipitofrontalis, but it's sometimes you'll see texts that refer to frontalis and occipitalis by themselves. But basically, you've got a frontal muscle, which is just above your eyebrows here, was kind of what would lift your eyebrows if you're, giving that surprised look. And that is got a tendinous sheath that runs from your forehead over your scalp to your occipital bone, to a set of muscles that basically do the same thing on the back of your head, but they kind of, they lift your brow and do things like that. So frontalis is the frontal belly of epicranius, and you'll hear about the occipital belly as well. So that's one that, you'll see different terms for. But anyway, orbicularis oculi, again, around our eye, orbicularis oris around our mouth. It allows us to close our eyes tightly, and the one around your mouth allows you to kind of pucker up. Zygomaticus major, again, causes us to smile. You don't see temporalis here because it's on the side of the temporal bone, but temporalis and masseter both are chewing muscles. You can feel temporalis. You put your finger on your temple and clench your jaws, open and close your jaws a couple of times. And masseter, again, you can kind of do that if you put your finger kind of more, let's see, kind of anterior to your ears, and then clench your teeth as well. I don't recall seeing it on that list, but sternocleidomastoid should be one on your list as well. Again, this tells you where it attaches: sternum, clavicle, mastoid. Sternocleidomastoid is a very important neck rotator. If one side flexes, the neck kind of turns to one side. If both sides flex, the neck again would flex straight down. So that's an important thing to think about when these muscles are bilateral. You can have one flex, and it's going to affect the neck or trunk one way, or you can have both sides contract, and they're going to affect the trunk in a different way. Again, platysma, very superficial muscle. You feel that if you kind of tighten up your neck, it's attached to a lot of skin. So again, you see that in some of these facial muscles, that where one of their attachment points is skin. So we can move the skin on our face, so we can smile or frown or whatever. You see less and less of that, as you move out of the face. Muscle is just attaching bone to bone. Again, trapezius, the only anterior part you see is the top of the shoulder. Trapezius is mostly a big back muscle. Pectoralis minor attaches the scapula to the ribs. There's 3 little fingers. And again, you obviously see what you're seeing is this body's left, what appears to us as the right side. Those are deep muscles. So all these superficial muscles on this patient's right side have been removed on their left side. So you're seeing pectoralis minor is deep to pectoralis major. And again, pectoralis major, when they're working their pecs, they're horizontally adducting their arms. So it attaches actually to the humerus deep in here. Deltoid, again, makes up the bulk of the shoulder. It attaches from the scapula to the humerus. Biceps brachii attaches from the scapula. It crosses both the shoulder joint and the elbow joint to attach on the radius. So the biceps both acts on the shoulder and the elbow. Brachioradialis, I think as far as we went into the forearm, attaches from the humerus alongside the radius. And that one is involved in, I believe it's golfer's elbow or tennis elbow. One, I can't remember which one involves this one. One of those two involves this one. One involves the extensor set. But brachioradialis is as far as we'll go into the forearm. Brachialis is a deep muscle, again, under biceps brachii, that attaches from the humerus to the ulna. So again, it works on the elbow there. Serratus anterior, like I said, you can see a little bit from the anterior side, but it attaches the scapula to the ribs, and it's often referred to as a boxing muscle because it protracts the scapula, brings the scapula forward. So when you throw a punch in boxing, you're not just using your arm, you're throwing your scapula into that as well. So look at the trunk, right up and down the middle, we have the rectus abdominis. Okay, that is the 6-pack. Going a little bit lateral to that, we see 3 layers. So the outermost layer is the external abdominal oblique, and again, named oblique because of the direction of the fibers. So the fibers go kind of superior to inferior as you go from lateral to medial. Okay, the external abdominal oblique is peeled back right here. The internal abdominal oblique is the next layer in, and those fibers go almost about 90 degrees So they go up as they go from lateral to medial, and then the transversus abdominis or transverse abdominal, but I always knew it the more Latinized transversus abdominis is the deepest layer in, and those fibers are kind of horizontal like a belt. They're transverse, okay, just like it sounds. So those are your three layers of the abdomen. You have your external obliques, internal obliques, and your transverse abdominis. Now, I'm sure you guys go into athletic training and stuff like that. When you hear people working their obliques, what are they doing? Well, they're not just doing sit-ups, they're also doing sit-ups and bringing like one elbow to the opposing knee. So they're twisting the trunk as well. So that's what these muscles do. These muscles twist because, again, look at the orientation of the fibers. All a muscle can do is bring 2 points closer together in a straight line. Just that same orientation of their fibers. These are present. We don't talk about them, pronator quadratus, supinator. So there are muscles that specifically pronate or supinate, but we're not going to focus on those. Again, the adductor group, I just know those as a group. I don't think I'm going to separate magnus and longus, and I think pectineus is in that group as well, which is not even labeled here. It's probably more superficial. But on the thigh, again, so this is our deep side. This is where you see the vastus. So vastus intermedius is right on the bone in the middle. When you have three, one's medial, one's lateral, the one in the middle is going to be the intermedius. So vastus lateralis is on the lateral side. You don't see vastus medialis on that side, but vastus medialis is here. So intermedius sits basically directly underneath deep to rectus femoris. All right, so when you look at a quadriceps, you're going to see rectus femoris, you're going to see a little bit of vastus lateralis, a little bit of vastus medialis, but you're not really going to see vastus intermedius unless you cut rectus femoris in what they call reflect it, which would be cut it in one attachment and turn it back 180 degrees at this other attachment. So you move it out of the way, basically. Sartorius, so named for this, the talar. Sartor is a talar in Latin. And what this muscle does, this long, skinny muscle, it crosses both the hip and the knee. So it causes flexion of the hip, flexion of the knee, and also external rotation of the leg as it brings this point over here. So if you're going to sit in what's called the talar's position, where you've got basically cross-legged, where you've got this ankle sitting on this knee, so a talar would do that when they're mending clothes or whatever. So sartorius, again, long, superficial one. You should definitely know. Longest muscle in the body, useless trivia stuff. The TFL, tensor fasciae lata, you see here a little bit. This is a relatively small muscle, but it's important in kind of standing and gait and keeping the knee locked in position when you're standing for long periods of time. The tensor fasciae lata is more anterior. The gluteus maximus attaches to this more posterior. Those both attach to the iliotibial band or iliotibial tract, which is basically a thick tendinous band on the lateral side of either leg. Sometimes this gets really tough in people, but it's important. It attaches to the past the knee, I think in the tibia and the fib, but it's the ITB, the iliotibial band, is very important in keeping the knees locked when you're standing for long periods of time. I think the only one in the leg I had is tibialis anterior. Again, that is the one on the other side of your shin that you can feel. That you lift basically you'd be dorsiflexing your foot with the tibialis anterior. This would be what people playing a drum set would be doing with doing bass drums with. They'd be working at tibialis all day long. It's got soleus and gastrocnemius labeled here, but you see that best from a posterior view. We'll come back. Okay, so again, from on the back, you have occipitalis, that epicranius, occipital belly. They don't really show the aponeurosis very well. Aponeurosis is the tendinous sheet or band. Oh, was that labeled there? No. Okay, so in some diagrams, it's not labeled on this one, but this white part here that you see covering the rectus abdominis, that would be the abdominal aponeurosis. We have the thoracolumbar aponeurosis in this region. If you see the big white patches, and again, an aponeurosis is just where tendons get large and sheet-like. Okay, so on the back, you've got trapezius, again, superficial, again, kind of trapezoid muscle. This is kind of what you feel is like the top of your shoulder, and this, what gets cramped when you're all tense because you're pulling your shoulders up all day. The trapezius attaches to the scapula, all right? Um, underneath, well, no, sorry, inferior to the trapezius, we have the latissimus dorsi, and this one is the one that, like in bodybuilders and stuff, gives them that triangular shape. So latissimus dorsi is a very wide, broad muscle that actually inserts on the humerus, and this is an adductor of the humerus. So how you work the latissimus is you grab that bar overhead and you pull down on it, or pull yourself up on bars, like do chin-ups, things like that. That works the latissimus dorsi. You can see some of the deeper muscles in that little window between trapezius and latissimus, infraspinatus, teres minor, teres major, but we'll look at that on the deeper side. Deltoid, again, you've got here on the back of the arm, everything posterior on the biceps would be tricep, or sorry, everything posterior on the humerus would be triceps, brachii. Again, 3 heads. The one on the anterior had 2 heads. Nothing else down the forearm. Don't worry about anything there. So on the deep side of the back, I'm pretty sure I cut levator scapulae out of there, but you want to know the rhomboids, the rhomboid minor and major. They're basically these muscles that attach, again, the scapula to the vertebral column. So they attach to the scapula. You see this trend where there's a lot of muscles that go from the vertebrae to the scapula, and then others that go from the scapula onto the humerus. And then you've got a handful that go directly from the vertebrae to the scapula, like latissimus dorsi. And it's kind of the only one I'm thinking of right now. Latissimus dorsi is the only one I think of, but yeah. But anyways, so again, the scapula is really kind of part of the arm if you think about it. So again, in the supraspinous fossa, you have supraspinatus, again acting on the humerus. Infraspinatus, you have let's see, is it not labeled there? It's not labeled in this one, but teres minor is right here next to infraspinatus. It's labeled here in the window, and then teres major is under here. So teres major, I always say, is like little latissimus. All right, it attaches to the humerus. It goes from the scapula to the humerus instead of the vertebrae to the humerus like latissimus does. But remember, the rotator cuff is teres minor, and that goes from the scapula up to the humerus, kind of more at the head. Okay, so the one you don't see here is subscapularis, which is actually on the deep side of the scapula. You'd actually have to take the scapula off the ribs, and very rarely do you ever kind of really see that in diagrams like this. You have to have specific deep ones. Serratus anterior, again, kind of along the ribs. That next is right next to subscapularis. So they subscapularis and serratus anterior are both muscles that are between the rib cage and the scapula. Okay, so you don't see those very often. Let's see. And you see the obliques. The obliques again come all the way around. The erector spinae is just a deep group that basically attaches our spine to the essentially the sacrum to keep everything upright. On the posterior leg, again, here's where you've got the gluteus maximus, is the kind of the larger meatier part of the buttocks. Up above, kind of under the pelvic crest, is the gluteus medius, and this is where they aim for injection. So if they're giving you injection in the hip, they usually aim for the gluteus medius. Deep to both of those, you have, or actually really more deep just to the medius, is gluteus minimus. If you remove the maximus, you're going to see this lateral rotators. And this one here, I think, is the piriformis. I wouldn't, again, ask the piriformis wouldn't ask you to identify the piriformis in place, but just know it's part of this lateral rotator group that's involved in sciatic issues sometimes. So down on your hamstrings, we've got your, on the lateral side, biceps femoris. On the medial side, we have semimembranosus, which is the broader of the two. If you think membranosus, membrane, is broader of the two. Deep to membranosus is semitendinosus. Tendon is kind of stringy. So again, we've got in this side over here. Oh, wait a minute. Oh, yeah, sorry. this is the more superficial side. So tendinosis you see on top of membranosus. So membranosis is broader, and when you see the two together, you can see tendinosis and you can see a little bit of membranosus underneath. But tendinosis has got this, like, again, like a more narrow, stringy tendon. And I always think membranosis is membrane is kind of, I think a membrane is usually wider or something broad. But yeah, so on this side, they've got tendinosis removed. If you see all three of them, again, biceps femoris is going to be on the lateral side of the knee. On the medial side of the knee, you've got semi-T and semimembranosus. And again, when you see the two together, semi-T will be more superficial. Semimembranosus is deep to semi-T. Down in the calf, all right, making up the bulk of the calf is gastrocnemius. Into the Achilles tendon, deep to the gastrocnemius is soleus, and you have soleus cut here as well. Gastrocnemius attaches to the condyles of the femur. So gastrocnemius crosses the knee. Soleus does not. All right, but they both act on the Achilles tendon. You can selectively stretch both of these. So if you were like lean forward so that you're in a kind of a dorsiflexed position, you'd be stretching both the gastrocnemius and the soleus, all right, as long as your knee is kept straight. But if you bend your knee and allow allow some slack in gastrocnemius, you would continue just stretching soleus. So again, if you think about why you do stretches certain ways or why you do exercise certain ways, it's usually to isolate certain muscles or tendons or things like that. So just something to think about. On the backside here, don't know worry about any of these. Again, I think soleus and gastrocnemius is really as far as we've got. So the rest of this is basically just cadaveric photos, things like I've taken out of a textbook. A whole lot more material than you ever need, close-ups on things. Like here's temporalis, and again, here's masseter. All right, again, there's kind of where to palpate that on your jaw. Zygomaticus major, all right, orbicularis oris, orbicularis oculi. There's your head muscles, your sternocleidomastoid. So I've got that list. So I think kind of what I'd recommend to you guys to do. And like I said, I know muscle is always a that and bone. You've got a lot of new kind of terms and things like that. But what I recommend doing is just kind of taking this list and finding each of these guys as one at a time. Like I said, I tried to keep it in kind of head, trunk, back, arm, and then leg. So it's kind of basically in that order. I may whittle a few things off of here, like I said, after talking to Dr. McDaniel. But basically, that's the big gist for today. It's going to be identifying muscles on either diagrams like you see on this PowerPoint, or like the leg, arm, torso model, things like that. And I think just to kind of make up for not having our hands on this week, next week when you guys go in, I think what I'll have is just a kind of a practice test, maybe, or I'll have some of them labeled just to kind of challenge you, to get you thinking, okay, what's what on the models. I've got keys we can always look at, but I think sometimes it's good to just do things like that as well. Okay, so I will take a couple minutes for questions if you guys have any. But honestly, I think I'm going to let you guys go and just kind of, like I said, that I would explore that list of, the muscle list to have on where is it? Let's just, hang on one sec. Google Chrome, there we go. So what we looked over today, the muscles to know list. The PowerPoint that we went over was this PDF here. Again, this one here, the PowerPoint is just something additional. I don't think I'd even mess with that. It's just something, it's just different material from a different textbook if you just wanted another look. This one I never even did open up, but is basically kind of an exaggerated Arnold Schwarzenegger, like, very large muscles of the body, at least the superficial ones. So it might be good to review as well. Don't forget about the quiz this week. But like I said, next week we'll we'll visit this a little bit more and more as we go. Next week we'll start in the brain, but we could always kind of take a few minutes and revisit here. All right, any questions? Okay, guys. Well, I've got this recorded, and for those of you who weren't here, I will put this up on YouTube, or if you want to revisit again, whatever. Thanks for your attention, and I appreciate you guys showing up. I'll see you guys next week. Thanks.